Everybody deserves the same amount of comprehensive care. And so it is on the healthcare systems to make sure that we can actually communicate with each and every person in Canada.
That's Dr. Amy Tan, and she's talking about medical racism in Canada's healthcare system. When it comes to COVID-19, vaccine hesitancy shows up in ways that are intertwined with this issue, sometimes even in our own families. I'm Romila. I'm just about to meet my co-host, Fábio, and I'd love to invite you to join us as we learn more about vaccine hesitancy in Canada. Hey Fábio, how's it going?
Good, how you doing?
I'm okay. I went to see my dad the other day, and he was one of the first people who could get the vaccine. He's over 75, and a day before his vaccination appointment, he canceled it.
Did he say why?
I mean, he cited a lot of reasons, side effects being one of them, developing cardiovascular risks, for example.
I totally understand, and your dad is not alone on that one. Actually, back in June 2021, Stats Canada reported that 51% of people who were hesitant to get the vaccine were worried about a possible side effect or risk associated with it.
Yeah, I mean, on top of that, my dad came and immigrated to Canada, and he had to navigate multiple systems that weren't necessarily built with him in mind. So I think very understandably, he's also wondering, was this vaccine made for me?
And that reminds me of the work of Dr. Amy Tan, because she calls out your dad might be experiencing a multi-layered issue that is present in many systems within Canada.
I'd love to hear more about what she has to say about this issue.
Hi, Dr. Tan. Thank you so much for taking the time to meet with us today. What I want to ask you about is if we can name the root of medical racism in Canada and how did it become a part of our healthcare system?
So medical racism in the Canadian healthcare system is multi-layered, but it actually stems from the fact that all institutions in Canada actually are built on what we call colonial framework, which really was at the start of Canada, that people of European descent were actually creating the rules and policies and giving the most advantage to those of European descent. And that's what we say when we say that it's a colonial system. And that then trickles down into what we call systemic racism. And systemic racism in Canada exists in all its education, healthcare, legal, prison systems. And so what we see in healthcare in Canada is medical racism playing out in terms of hospital policies, medical research being really focused on the dominant narrative of the people of European descent. And this has been long-standing over all of history in Canada.
Right, so what we're seeing today is the impact of that history. And Dr. Tan says that one way to address medical racism is to provide cultural safety when Black, Indigenous, and people of color try to access healthcare. And that can look like thinking about how far away reserves are from healthcare facilities, or not expecting people who are fluent in other languages to speak English.
Yeah, I feel like seeing yourself in the system can also be a form of cultural safety. When Indigenous communities on Vancouver Island first rolled out the vaccine, they integrated Indigenous healthcare systems, and that's existed for generations before this current one. One of the teachings was protecting yourself today can protect others in the future. And Dr. Shannon Waters is one of those health officials who helped lead this effort. Thanks for taking the time to meet with us, Dr. Waters. I know that not only were you one of the health officials leading this effort, but as a Hulkaminam woman from Stamanis First Nation, I'm wondering, what was your approach to the vaccine rollout in the communities you worked with?
There were some nights when I was sitting up awake wondering, what could I do? How were we going to get through this? And I thought about my ancestors who had dealt with communicable diseases in times gone past, and how I had tools that they didn't have at that time. What happened throughout the course of this pandemic is earlier than anyone might have imagined. We had vaccine that was available that helped curb infections and prevent serious outcomes. And we were able to advocate here in this province for priority vaccination for our Indigenous populations because we were being very disproportionately impacted. by COVID-19.
And I'm curious, what was the impact of the vaccine rollout? Was it a night and day difference?
It took a while for vaccine to be available for our communities, but what we noticed as the vaccines that we were providing, the numbers were going up. We could see the number of cases in our communities coming down. So we actually saw like a direct effect with what we were seeing in terms of cases being lowered by the vaccine we had been able to make available.
Let's build this.
Yes. So we are going to build what Dr. Shannon Waters calls the happy graph. So I'm going to start in October of last year, and then we're going to end off at April of 2021. I feel like I have so many blocks on my side. This is a pretty good base. So let's start building out what the cases look like when they start rising. Last few ones. That looks so good.
So what are we looking at here?
Okay, so this is what Dr. Shannon Waters calls the happy graph, and it represents the number of positive COVID cases in Indigenous populations in Canada. So the graph begins in October of 2020, and you can see that there are already some cases and they begin to rise very quickly in Indigenous populations. And it takes us to around January, December, when the highest number of COVID cases in Indigenous populations begin to happen. It's really interesting because this is also around the time when vaccines begin to roll out in Indigenous communities.
And you can see a steep decline starting here until here.
Yeah, so it almost cuts the COVID cases down by 80% as soon as the vaccines begin to roll out in these communities, including Dr. Shannon Waters' communities in Vancouver Island. And it takes us to April in 2021, where you can see the number of cases is almost as low as the beginning of the graph.
That is so interesting.
Yeah, it's pretty cool. And that's why it's called the happy graph, because you see this lovely decline, and it was a breath of relief for Dr. Shannon Waters and all of the communities that she was serving. You know, as happy as the data is, I'm not sure if showing my dad graphs is the most empathetic way to relate with him.
Yeah, the numbers are amazing and they provide so much context, but sometimes it's important to take a step back and listen to the people in our lives. And that's what Dr. Akwatu Khenti told me. And he was actually having really similar conversation with his mom.
Do you think I can talk to him sometime?
Absolutely, yeah.
I'd love that. Hi, Dr. Khenti. I know both our parents were vaccine hesitant. I'm wondering how that conversation went with your mom.
You know, I realized my mom was supposed to get a vaccine in February. I checked and I said, how did that vaccine go? And she says, I didn't get vaccine. I canceled the appointment. I said, why? Why you cancel the appointment? She doesn't want to get a blood clot. So I said, Mom, you're 80. You're not going to get a blood clot. She said, boy, don't bring that doctor business to me at all. The last thing she said was, you're trying to frighten me. Go. Goodbye. So I had to take a step back. I'm talking to my mom, and authority, evidence, it's not about, it's about listening and being empathic, having empathy for the position she's taking. Don't argue. You need to take a step back and make sure there's no emotion, no intensity, because you gotta have a relaxed conversation. It was so important for them to get her vaccinated, but it took a time, and it took patience, it took waiting. And it had to be an act of love as well.
Hey, it's so good to see you.
It's so good to see you too. I actually been thinking a lot about what you told me. And after all this conversation we've had, have you had a chance to talk to your dad about his vaccine appointment?
Yeah, and he found a doctor who could speak Farsi, and it eased a lot of his concerns. They were able to have these great conversations. And in the end, he booked his appointment and got his first dose.
That's amazing. I'm so glad to hear that.
Thank you. I think in the end, it was a little empathy that went a long way.
Break the fourth volume immediately. Like, how was that? How was it? Was that good?
Wherever you are, and take you to a vaccine clinic whenever you decide. I will come to you. You don't have to go there. You stay home, I come to you, I'll drive you. I'll drive you across town. I'll drive you to another town. I'll drive you wherever we have to go to get a vaccine when you decide to get the vaccine.